Hey there guys, welcome back to Coptalks and another video. Today's video is going to be about medical supplies. I had someone down in the comments ask me what kind of medical supplies, first aid kits, things like that do I carry with me on and off duty. So we're going to start on what's on my body and then transition into things that are around me, right? So right off the bat, one of the main things I carry with me every day is just a tourniquet, just a basic tourniquet. Just one is better than none. Two is even better because you have 4 limbs, keep that in mind. But one tourniquet at least at all times. And then usually on duty, I have on my belt a glove pouch. So I carry some gloves. Universal precautions, very important. You're in a very dirty line of work. You can at least insulate yourself as much as possible. Another thing that a lot of people don't consider a medical device, but will be used as a medical device, is a knife or some other cutting instrument, such as a strap cutter, right? This one's from Benchmade. This one, this is like El Presidente right here. I got this from a prison guard. This is actually meant to cut people trying to hang themselves. And this thing is freaking sharp and it's huge. You can use this to cut boot straps, belts, seat belts, clothes, anything that might be getting in the way of you getting to that injury and treating it. So yes, these things are considered, in my opinion, medical supplies. So moving on from there, we have my ankle medical kit, right? I kind of briefly went over this in another video, but the ankle medical kit is something I wear all the time on duty. Off duty, it doesn't really fit my clothes as much because it is kind of bulky. This wraps around my ankle and then Velcros in place. And it's got quite a bit of stuff in it to kind of get me through a variety of situations. Now, this is set up for hemorrhage control and trauma. Keep that in mind. This is not like I scraped my knee first aid kit. This is my knee has been blown off by like an IED or a 12 gauge slug. So starting off in the first pouch here, this is just an elastic adjuster. You can adjust this for various sizes. I have this to go over my boot. And if I'm wearing like low cut shoes or something, I can take this off and then actually just go around the ankle. So starting off over here, we have a North American Rescue cat tourniquet, pretty standard. This is one of the older ones, but it still works just fine. Probably gonna replace it soon anyway. And then we have a nice little ace bandage. You can use this to keep pressure. You can use this to hold stuff in place. You can use it to manufacture a sling for an arm. Here we have a couple of forceps. I can use this for digging glass out. I can use this for, don't ever pull a bullet out. Like in the movies where they're reaching in there and they're like, oh, I'm going to get the bullet. Don't do that shit. Please don't ever do that shit. You're just going to cause more damage, more bleeding, and you're going to piss a lot of medics off. So don't do that, please. But you can use this to hold stuff closed if you need like a clamp, because these are kind of like the ratcheting ones. They have these teeth right here and they can lock in place, holding things in place for you until, somebody who knows what the fuck they're doing shows up and yells at you for things. Then in here, we also have just some cheap little shears. These you can use to cut off clothing as well, and cutting tape and things like that. These have like a plastic safety nub on the front. That way you don't accidentally stab your patient when you're going up some jeans and you get real close to the nether regions there. This pocket right here, there's a set of compressed gloves and an antimicrobial hand wipe. This kind of lets you clean up before or after, depending on what the situation is. Always keep those with. Another thing I always keep in here actually is this Celox. This is a hemostatic agent. This allows you to kind of stop minor cuts and lacerations. It's a little bit better than a Band-Aid, which I needed yesterday because I got a new kitchen knife, which was sharper than I anticipated. But we don't talk about that. But this right here is a 2-gram packet made by Celox. Really good stuff. They make some quality hemostatic agents. And then I also keep a little bit of cash in there. Since I wear this all the time, it's just kind of handy to have. I think it's like 40 or 50. It's about $50 just in case. Then the main item here is Celox Rapid. So this is a hemostatic gauze similar to QuikClot. This one's made in Israel, and they've been shooting each other over there for a long time, so I imagine they kind of know what they're doing. This stuff is pretty good, pretty reasonably priced. It's lightweight. This weighs next to nothing. And you can ram this into a wound. Like, you got the tourniquet on, you determine the exact location of the wound, you know, pack this into the wound, you can wrap that ACE bandage, or better yet, a trauma bandage over it, and then you're good to go. Well, for a little bit at least. Then on the inside here, I'm not really going to pull them out too much because it's kind of a pain in the ass to get them back in, but I have 2 chest seals. So these are some North American Rescue chest seals. Those are for entry and exit wounds. If you're shot in the chest, kind of keeps you from, you know, having some more issues there. You don't want air to get into the chest cavity, at least not the wrong part of the chest cavity. And then right here I have some identifiers, and this is kind of bullshit stateside. They're gonna blood type you no matter what if you get pulled into an ER, but I have that kind of left over, so I just slapped it on there. And then I did want them to know that I'm allergic to sulfa medications, and that I don't want to die from an allergy versus a gunshot wound. So this is what sits on my ankle. Next, we'll move on to things that I keep around me, like in my bags, in my vehicle, and in my go bag, right? So let's get on to that. So things that I keep around me. This is an emergency first aid kit. I picked this up somewhere. I can't remember offhand where, but I really liked how this thing was set up. This is technically kind of like a refill kit, right? If you have an IFAC or an individual first aid kit or something like that, you've used it or it's expired, this is technically a refill kit. I think it's perfect for police officers because chances are you're not wearing like an IBA or like an OTV or some kind of tactical vest or something where you can have a whole fucking IFAC hanging off the side about the size of like a 4-pack of beer. But you can throw this into a duty bag or, you know, a little medical bag, you know, whatever. And what I really liked is on the back here, it lists everything that's in it and the expiration dates for each thing. So you're supposed to go through your kit and make sure that nothing is expired, right? You want to keep everything up to date. You want to keep things in working order, and you want to make sure that anything that has a shelf life is still well good into that shelf life before you get to a shit situation. So instead of having to go through every single item and checking the expiration dates, you can buy a kit like this, and it says like the trauma dressing, you know, good till 2024, burn dressing 2022, chest seal 2023, you know, quick clot 2022. So you can just look at this and be like, ah, shit's good to go, or no, it's not good to go, it's got to go. And just going over the items here, I'm not sure if you can see that on your screen or not because my camera is total shit. But we have an Israeli emergency trauma dressing. Now, I was told we can't call them Israeli bandages anymore, but they're like a trauma pressure dressing. Basically, you can take it, slap it onto the wound, it comes around, cinches down, applies pressure to the wound while also keeping it closed, and then you wrap it around, and it just makes it a real nice, neat package. They're super awesome. I definitely recommend checking them out. Burn dressings or super cravats. I've never really used a burn dressing. I've never been in a field long enough or had a patient in the field long enough to where I've had to treat burns. I usually get them, you know, out sooner than that, but those are in here. 1 package of compressed gauze, some trauma shears already in the bag, 1 chest seal, which preferably you'd want 2 for entry and exit wounds, a nasopharyngeal airway, which if you're not trained in using one of those, don't fucking use one of those because you can shove it in somebody's brain, especially if they have a head injury. 2 medical tapes, 2 pairs of non-latex medical gloves, 1 skin marker, and some quick clot combat gauze. That's a handy little package. I mean, it's got a ton of stuff in here that you could totally use. I like this. Now, I don't really like the tape in here because this is like kind of that paper medical tape, which is fine, but it tears fairly easy and is not the best thing to use if you're really trying to hold some shit down. You're going to want some plastic based, like some 3M or something. But this little kit is great just as an already thrown together. You can throw it in your bag. This sits in my active shooter bag, and I can take it out. I'm not going to open it, but you take it, you can rip this open, and in fact, you can actually use this plastic as another chest seal with that tape. So this is a really, really handy little package to have. Another one very similar to this is called the North American CIRC, which is an SIRK Gen 2 kit. That's a really, really well put together kit too, and that's something I'd strongly recommend people look at. It comes with 2 Generation 7 cat tourniquets, legit cat tourniquets, a 4-inch trauma dressing, quick clot like this one, compressed gauze similar to this one, a decompression needle, which also don't use one of those unless you know how to use it, another nasal pharyngeal airway with some lube, an eye shield for eye injuries, 2 chest seals like I recommend, some really good quality tape, medical tape, a Sharpie, and then it actually, that's where I got this Benchmade hook. It actually came with a circ. So you get a Benchmade freaking tool with the medical kit, and it's handy dandy little Molly compatible little mount here. And then you also get a casualty documentation card. So if you got a mass cal event, each kit comes with its own marking identification for that patient. So you can say like, this motherfucker's DOA, you got ambulatory, you got walking wounded, you can like label them and let the next level of care know what's going on, what's been done, what's an issue, even if the patient can't talk. So those are really good. And a fun fact, these things right here are like, I don't know, like $30 because it's Benchmade. And the whole medical kit right now with free shipping is $79. So you get 2 quality tourniquets and a ton of other medical gear. It's like $130 value for like $80. It's a win-win in my opinion. Now, moving on to the most important thing that I carry, right? This is something I use all the time, more than any of this other equipment minus my knives combined. And that is a little Johnson & Johnson first aid kit. This is their travel one. I think you get it for like $1 or $2 in the travel section at Walmart. And I've kind of augmented it a little bit. I got an extra pair of gloves in there because people are disgusting. I put a couple extra Band-Aids and some small gauze and, a little cleaning towelette and stuff like that. Because more than likely, you're just going to have some minor little bullshit stuff. Somebody cut themselves with a pocket knife that they're trying to show off to you, or somebody threw a rock and hit somebody and whatever. I'm not using my medical equipment on a civilian, but like, if you got another officer there that got into a tussle or was chasing after a guy and ate shit and hit the sidewalk and scuffed up his knee or his elbow, boop, little first aid kit. This is what you're going to use more times than not. This right here is kind of like what I consider 80% gear. You're going to be using this 80% of the time, and hope to God you never have to use that other shit. But if you do, you better have it and you better know how to use it. But this right here is something that you're going to use more often than anything else. So anyway, guys, that's kind of a general overview of my medical equipment that I carry on duty. My gear changes all the time, so I try to do update videos as much as I can. And the reason why it changes is because whenever I go to new classes or I interact with somebody else who's maybe more knowledgeable in something than I am, I kind of adjust my equipment based on my level of learning. So as soon as I learn more about something, I try to match my equipment to my skill level, if that makes sense. Anyway, guys, I really appreciate you watching this video. I know it's gone a little bit longer than my normal ones, and as you can tell, I'm pretty passionate about medical care, coming from a military medical background and then a tactical medical background. So anyway, guys, really appreciate you watching this video today. I hope you stay safe out there. I hope if you're looking into this stuff, you are looking into it for a valid reason. I think everybody should have some basic level of medical care, especially in hemorrhage control in today's day and age. And you should definitely get educated. You should definitely get training, and you should definitely become more confident in yourself. And I don't have anything else for you today. Please have a good day. Please stay safe out there. Take care of each other, and I'll catch you in the next one.